So, but when we talk about darkness, it's more than just negative emotion. What else? What else is darkness?
Can I just comment on the thing that we were just talking about in regards to, I think that you have to know when to do that, use that intervention, right? Like I had an individual who came to me regularly. She'd come and she'd sit into the office. I know that she went through trauma, but she wouldn't talk at all. I would have to do all the work and ask all the questions. And finally I just said, when she came on the 7th session, I said, I'm really frustrated. But I had to wait. I had to keep waiting.
So sessions, nothing.
I felt I had to keep waiting and waiting until she would break out of that.
Some sessions, nothing.
But she told her mother that, she said, I don't like her because she got angry with me. But I'm like, angry? Really? She took that as anger? Like, I wasn't angry. I just said, I'm really frustrated that, she comes every single session and you're not sharing a thing with me.
Okay.
I don't know what to do.
Okay. No. This time, your fairness, okay? Your fairness, okay? I'm saying that your frustration is a little bit premature. Let me tell you why, okay? That's why I say, right away I see my gut feeling, say, 7 weeks is nothing. Because if you have some deep pain,
Yes.
deep trauma, unspeakable horror experience, 7 weeks is nothing. Why should a person willing to be re-traumatized, willing to endure the pain to reveal their guts? Sometimes it might take 1 or 2 years before they finally reveal their inner pain, the inner hell. And often they might not tell you directly. They'll write down a story or in century or in painting. That's why art's very important, because when you're in so much pain, words are inadequate, right?
So I tried all that with her.
But 7 weeks is nothing. But 7 weeks is nothing. You have to be patient, because you understand the deeper the pain, the longer it takes.
Yes.
Right.
So the other thing that I brought to her attention is because I live in a small community, so I seen her interacting with all these different people. And I brought that forward. I said, I see you in the community and you interact with all these different people, but yet when you come in here, you sit quietly and silent and you don't say anything. And so what I should have gave her more time.
Oh yeah.
More time.
Why did she keep coming?
I asked her that, but she didn't answer me.
Okay. See,
Why do you keep going?
that's something to work on, right? If they are resistant, if they are afraid to touch that area, I know there's something deep, that there's some deep hurt there. So that's a warning sign, a signal that there's something very deep.
Yeah.
There's something very painful.
You're very correct, but she shared it with her teacher, she shared it with lots of different
Because
people.
they're in a superficial way. But now it's real deal.
Yeah.
Now the therapy is,
The problem I have is that I don't have enough time to see them for 1 or 2 years.
okay. I understand that, okay? Because right now, managed care, okay, or government say 10 sessions maximum, 8 sessions, okay? But you don't have a luxury to see the person for 2 years, 20 years, okay? But you can, there's a problem there, okay? But you can, for example, you can encourage them to go home, write the story, okay? or write you a letter, whatever. You might never get to the bottom of the math, but you should be able to at least give the client some new understanding, some new strengths to deal with them on their own later on. Okay, but this whole problem, you can't see the client for them. You understand what I'm saying? Go ahead.
Well, the interesting thing is she did come into the next session and she did talk.
Huh?
She did come into the next session and she did talk.
Good, that's good, yeah. But I'm saying that this is not your experience, but common experience for therapy. They refuse to talk about the deep pain, especially when it's really hurting. For example, being raped by a grandfather, okay, or being raped, abused by the mother's new husband, okay. But something are so horrible that it takes a long time to.
My expectation of her, and I told her, is not to really talk about that. Let's talk about school. You go to school.
Oh yeah, but
Let's talk about these other things.
Yeah, they will depend on nature. That's why.
Yeah.
If a real serious problem, serum makes nothing, okay?
Yeah.
But for ordinary, not ordinary, but less serious problem, okay? If still the client will show resistance, he's hiding something, he's trying to hide something. To you might be this small thing, but it may be an iceberg or something bigger. So that's why I remember last time I mentioned about resistance is a good thing with therapy. Because whenever the client shows resistance, you know you're onto something. You're onto something. Where's my wife? She has something to say.
Yeah, as a psychotherapist, the hardest thing is there's no cooperation from the client. And silence is almost interpreted as, I don't want to be here. And I think this is, we emphasize relationship. We emphasize that this is the only place, I'm the only person that will listen to you whenever you are ready. And I could give you examples that you just be there for them. What do they want? As long as they come. If they don't come, then you don't have a chance. As long as they come, and you just sit there. Just to give you 1 minute about an example that I had, and one of my male student, and he was so frustrated with his client. Didn't do anything. He sat there. The first time, second time, he wanted to show me that he has, skills. But this show wasn't doing anything. After 3 times, he said, "What are you going to do?" But he came. And one time, he was sick. I went into the office and I told the boy, I said, "Your counselor is sick, so would it be okay for me to, to do with you?" And all of a sudden, the face just sagged, feeling so sad. And then he said, "Would that be okay if I make a picture on this table and you take a picture of it and then you could give it to him?" The relationship is there, but the child doesn't know how to express it. Obviously, in the family, there isn't anybody who would express emotions. So right after that, we took pictures. And could you take another picture? And we took another picture. And next day, the 2 of them were just playing. So sometimes it takes time, as Paul was saying, something inside you cannot express. It takes time, but you are there.
Okay.
You are,
I just two hands.
I
You
just-
and then. Yeah.
I think as therapists, we have to push ourselves to not look at things in a singular way. Because the person just coming and not talking is actually expressing. And you have to just bear witness and go with it. And when the time is right, it'll evolve. So sometimes we have our own expectation that I have 7 sessions, 8 sessions, 9 sessions, I have to do certain work. And that's not, it's a client's process. And you can feel good. I have had clients who haven't spoken for 1.5 years. And when they did, the first thing and only thing that came out was, Madame Rita, will you help me? And after that, just quietness. And you can say, yes, how can I help you? And there's pin drop silence after that. Right? So I had to just go with what I didn't think about what is successful. Whose outcome am I? Whose agenda am I serving here? And the person came every time on time. And after 1.5 years, he spoke.
Okay, you first, then you. Okay.
So, this is a little bit different, because normally we just think of silence as resistance. Right?
Can speak
Look
louder.
at silence as resistance,
Uh-huh.
but because we tend to just look at the mind and we tend not to really look at the body. Like once I met with this Chinese medicine doctor, and we were talking because we're consulting with the same client, right? And he said to me, you know, Marcy, this lady doesn't like to talk because it drains her energy. So what you might see as her not wanting to, it's not because she doesn't want to share with you, it's just the nature of who she is. So talking a lot. So to me, like we usually focus on, like you talk about having a singular way of looking at things, but also what is that personality style of that person themselves? You know, how do they approach things in terms of communication?
It has a lot to do with trauma and darkness, and when people will repeat also.
I think the other thing for me, just it's a great conversation, because I do have at least 3 students who come and do not say anything to me. And I know, unfortunately, the clinical supervision that we have, it very much depends on my clinical supervisor's worldview, because we can only see them 7 or 8 times. And the question is, okay, so what did you do, Renee? What did you talk about? What's your plan for this person? And I think that has an influence on how we see students who they just come. I've got one who just sits, and I've got 3 of them. And it's okay for me. I find value in that because, like you said, Lillian, all female actually, they come. Excuse me. And that's where they're at. But I think if your clinical supervisor holds you accountable somehow for some kind of divine intervention.
Sometimes it's not your clinical supervisor, sometimes it's just the statistical information you need.
I know.
Goals that you
Yeah,
have to
yeah,
write
that's
up.
right. It's a treatment.
I mean, how can you do
Yeah.
goals with somebody if they aren't even talking to you?
know what?
You have to collaborate with that person.
Oh, you have to be creative in mindfulness talk, couch it in that rather than, the verbal stuff.
Sure.
Yeah.
And I kind of threw that back at me, I was like, and that was all communication, yes, I
Yeah.
understand it was all communication. And I was,
And
of
safety,
course, I did
think
say,
needs to feel sorry.
yeah.
If I can just share an experience, I was a practicum student, and I was working with was going to meet a 7-year-old boy with his father, and this boy came in with his father, and if the father was sitting in this chair, right, the boy sat behind the chair for the whole first session and didn't say a word to me, and like sat behind the chair. So I'm like gaining information with this father, and in my head, I'm like, what the heck am I going to do? This kid is not talking. But I knew I was able to actually kind of draw on my own self because I'm generally a quiet person and I'm comfortable in quiet. And probably even last week I didn't say 2 words on Saturday because my style is to absorb my environment and reflect on it and figure out my own entry point into where I can accept my environment, if that makes sense. And so I just sat with this little boy and I literally like went on the floor, and I remember going into supervision with my practicum supervisor, and I was like, I don't know what to do. I don't know how to engage him, and I don't know how that's going to be therapeutic. And he gave me the best advice. He said, your goal is just to give him a positive experience of counseling. And that may be the only step you take. And that may be the only thing you do. And you may not touch the anxiety his parents see or the problem he relates to. And if you just foster that positive relationship, and that's it. And that's all I did. And I would just play with him. And it wasn't until the end did I start to even gear into things that were therapeutic or interventions. And I just played with, and I just engaged with him at his level. And I got to see, I was lucky enough for him to continue in the practicum. And so I got feedback from other practicum students that have seen him after and had noticed my notes. And he engaged, every time he saw a different person, he engaged more and more. And I learned that sometimes all you do is plant that seed.
Okay,
yeah.
so we're gonna move on.
Yeah.
I'm sorry.
Sorry, I went
Thank you,
off.
thank you, very good, thank you. Now, do you remember?